From the very beginning of this crisis, I followed the advice of our world-leading scientists.
Right since the start of this crisis, we've been clear that all our plans are based on the best possible science.
We have been following the scientific
and medical advice.
At each point, we've been following the scientific
and medical advice.
At all stages, we have been guided by the science.
When coronavirus arrived in Britain, the government made one thing clear.
Everything we do is based scrupulously on the best scientific advice.
But Britain has ended up with one of the worst death rates in the world. Coronavirus has killed more than 50,000 people.
They knew it was coming, and they knew it was all over Europe, but they didn't act fast enough.
So how good was the scientific advice the government relied on in the run-up to the first lockdown?
I think I should have thought, if northern Italy has got an epidemic, then it's quite likely that other places in Europe have probably got an epidemic as well. And I didn't think that.
Now, scientists at the heart of Britain's response are telling the story of what happened behind the scenes, some speaking for the first time.
It felt like the data situation was less good in the UK than it was in the Democratic Republic of the Congo. Basic information, basic epidemiological information was missing.
The public may be surprised that we were using Wikipedia to get data very early on in the pandemic, but that was really the only data that was publicly available.
That was the first time when I started to feel like things really were not in control.
So did the scientists fail? Or could they become scapegoats for Britain's high death rate?
I think following the science is a meaningless phrase. No government does that, nor should they, because there's many other factors to take into account.
If that's the message, coughs and sneezes, but wash your hands for the national anthem.
Stop shaking hands.
The reality is that what we've ended up with is that out of a population of around 400,000 older people in care homes, 20,000 have died.
There's going to be a lot of criticism of the scientists because it's easy to have hindsight. It's easier to say, if only we'd done this a week earlier, we'd have saved 5,000, 10,000, 15,000, 20,000 lives. Pick your figure.
The failure of the science will be seen as one of the most important features in what has been a very, very poor response to this global health tragedy.
My name's Dr. 𝗕𝗶𝗰𝗲. I study viruses and I've been doing that for 30 years or so now. So I first heard about the new virus around about Christmas, New Year time, I think. We, at that time, were the only team that were working on human coronaviruses in the UK. I think my first thoughts were it would flare up and probably not get too bad. And then as it progressed and you saw more and more infections, yeah, I was very worried.
According to authorities, the number of cases has increased to 44, with 11 of them in serious condition.
The mysterious new pneumonia virus has been confirmed in Thailand. Now, this is the first time the virus has been confirmed outside of China.
As the virus spreads beyond China, the UK government calls an emergency meeting of its expert advisors on the new and emerging respiratory virus threats advisory group. 𝗏𝗏𝗃 includes some of the UK's leading scientists, and its advice goes to the government's chief medical officer and on to ministers. 𝗏𝗏𝗃's first job, to advise on how the UK should respond.
There's always a bit of a buzz when there is an extraordinary meeting called. We had behaviouralists, virologists, people who are experts in epidemiology, and that's the mathematics that sits behind outbreaks. And we had to start deciding what were the next steps.
You have to remember there are not many coronavirologists in the UK at all. I kind of half expected someone in the government to say, is there anybody working on human coronaviruses? Is there anybody working on dangerous human coronaviruses? Is there anybody who's got a containment facility and working on dangerous human coronaviruses right now? And that didn't happen.
Quite a few of us had read the literature for SARS and MERS, but if you were to say, is there a particular specialist that has just focused their entire life on human coronaviruses? No, there was no one on there at that time.
The government has a simple question for 𝗔𝗃𝗃. Airports across Southeast Asia have introduced health screening to detect travellers with the virus. There are 3 direct flights from Wuhan to Heathrow every week. So should passengers be given health screening here?
Port screening is very insensitive and doesn't pick up people with disease on an effective enough basis to stop movement of a virus into a country. If you want to stop it, you have to close the ports completely, because you've got an incubation period of, say, 5 to 15 days. And if you get on the plane having caught the virus in one place, you're not going to pick up people with the fever or the coughs or the sneezes with symptoms. So port health screening just doesn't work.
I think I would have been pressing harder for thinking seriously about screening people coming from Wuhan. On the face value, you'd be thinking, well, that's not actually a huge imposition at an airport in the grand scheme of things.
Here, passengers arriving from Wuhan were not being screened, but told to seek urgent medical advice if they start to feel ill.
A woman with the virus flies in from China. She passes through the airport undetected.
There was a steady flow of people coming in from various countries as the virus spread. We left our borders open, we left the door open to the virus, and that contributed substantially to the very rapid growth in the virus that we subsequently saw.
In the city of Wuhan, the coronavirus has already claimed the lives of 17 people, but the number is expected to rise sharply.
Chinese authorities are taking drastic action to try to stop the spread of the new coronavirus. They've imposed a travel shutdown on several cities, notably Wuhan, where the virus was first discovered. Here, the government says there's an increased likelihood of the virus reaching the UK.
The government wants to know how much of a threat coronavirus poses to the UK population. 𝗔𝗃𝗃 says the risk is low.
The 𝗔𝗃𝗃 risk assessment process is a snapshot of the actual risk on the day. It's a bit like the notice that you see at the front door of the police station or the military base. What is today's risk?
It's a little bit more like falling out of an aircraft without a parachute. The risk of you dying in the next second or two is very low, but you are going to die.
𝗔𝗃𝗃's advice is used by the government to reassure the public.
We just held a 𝘃𝗶𝗰 meeting on the coronavirus concerns. And as I made clear to the House yesterday, the clinical advice is that the risk to the public remains low, and the Chief Medical Officer will be making a full statement later today.
Boris Johnson misses that 𝘃𝗶𝗰 meeting, but he still finds time that day to celebrate Chinese New Year.
Prime Minister, are you concerned about the coronavirus coming to the United Kingdom?
On the same day, new research estimates that every infected person in Wuhan is passing the virus on to 3 others.
When the first numbers for the infection rate, the R0, came out, quoted as somewhere between 2.5 and 3.5. And that's when I just thought, oh, shit. This is going to go. This is going to go. This is going to run around the globe.
Professor Anthony Costello is an outspoken critic of the government. Its approach to the virus leaves him worried.
You have to say, could this be the big one? Yes. Has it got a worrying case fatality rate? Yes. Does it spread rapidly? Yes. So it was then a managerial issue about your pandemic response. How are you going to test and get the results? How are you going to lock down cases and contacts? And how are you going to make sure that they isolate? And most important of all, scale it up. How are you going to do that quickly?
The public health approach to handling a major outbreak like this would be clamping down on the virus and trying to eradicate the virus as much as we possibly could right from the earliest point, and making sure that there were proper test and trace, isolation, support mechanisms in place. None of that happened.
By now, another committee that will become central to the government's response is meeting. The Scientific Pandemic Influenza Group on Modelling, 𝘃𝗶𝗰, includes infectious disease experts from 7 universities who use sophisticated computer simulations to try to predict how viruses spread and what can be done to stop them. 𝘃𝗶𝗰's advice goes to another committee of experts, the Scientific Advisory Group for Emergencies, SAGE, and then on to the government.
Models are a way in which you can put together what you currently know to develop an idea about what might happen. So they fill a gap in those first few weeks of a pandemic because we have some evidence, we have some data, some information, but it's not enough to understand completely what's going on. So models are used to then try and predict what might happen.
Using a range of models, 𝘃𝗶𝗰 makes a best guess for the government about how the virus might spread among the population.
The whole point of 𝘃𝗶𝗰 is to generate a consensus view. You know, we don't rely on one model because a single model can easily be wrong. So what we try and do is to make sure that we have at least 3 different independent groups saying, right, this is our best guess, this is what we think is going to happen.
But at this crucial stage, there's a problem. The most accurate information about who is catching the virus and how it is spreading is being gathered by the authorities and academics in China. Some groups on 𝘃𝗶𝗰 have the resources to gather large amounts of Chinese data, but other groups are struggling. Modelers at some universities are becoming frustrated.
So in the early stages of the pandemic, a lot of the modelling groups involved with 𝘃𝗶𝗰, my understanding, has had a real challenge with accessing data. These models, we have to remember, are only as good as the data that go into them. We need to make sure that we have access to the most accurate data, because the better data that we have, the more accurate the predictions that come out of these models are going to be.
In Manchester, it's the same story.
The public may be surprised that we were using Wikipedia to get data very early on in the pandemic, but that was really the only data that was publicly available that we could access. I think it's too strong to say we would definitely have made recommendations earlier if we'd had access to the data, but we will never know because we didn't have access to the data.
There are always data in those early stages filtering through private networks. And so if you're not involved in those networks, then potentially you feel excluded. But that's kind of inevitable. You can't overcome that. It's just that those people who've put that effort in to create those networks necessarily have a head start in terms of being able to look at the data.
Two patients from the same family in England have tested positive for coronavirus. The first cases to be recorded in Britain.
There were 4 new cases of the virus announced yesterday. It takes the number of people infected in the UK to 8.
The first confirmed cases in the UK are studied closely by the modellers to try to predict how the virus might spread here.
So there is this system of what's called the FF100, the first few 100. So as cases arrive in the United Kingdom and diagnosed, then they're put together in a database that says this is what happened to these people. And that's our first data set, if you like, in terms of modelling.
Unfortunately, the first few hundred data was not as good as we expected. There was clearly quite a few mistakes. Basic information, basic epidemiological information was missing. At the time I was coming back from the Democratic Republic of the Congo, where I spent 6 months as part of the response to an Ebola outbreak. Very, very messy situation in a war zone. You expect messy data there. It felt like the data situation was less good in the UK than it was in the Democratic Republic of the Congo.
Modelers always want more and better data. You could always want it more complete, you could always want it more accurate, but nonetheless the data that we had fulfilled that purpose. We were in quite a good position to understand what might happen in the United Kingdom.
It just adds a lot of uncertainty. And you end up having to say in your forecast, in your predictions, well, on average we think this is what's going to happen, but really it's between this lower bound and this upper bound, and these bounds are like very large. That was just a constant drawback in any kind of forecast we could make.
By now, the threat level in the UK has been raised to moderate. Within 2 months, more than 10,000 people will have died from COVID-19. But at this stage, across Britain, ordinary life continues. In the second weekend of February, more than 160,000 people attend the 4 biggest sporting events in the UK. SAGE is now meeting regularly, bringing together expert advisors from 𝘊𝗵, 𝗔𝗔tag, and a committee of behavioural scientists known as 𝘊𝗵𝗶.
So if you said, well, let's ban football matches, yeah, then if the football still carries on, then potentially those 50,000 people who would have gone to the game and stood outside next door to each other for an hour and a half are all going to go to the pub. Yeah? And in fact, in terms of transmission, being outside watching a football match is probably a better place to be than it is to be in a pub.
In order to get to these gatherings, people had to take public transport. We'd often spend time in the pub before and afterwards. And that greatly increases your chance of catching a coronavirus like this. And so I think, yes, these gatherings probably should have been stopped at an earlier stage.
The scientists' role is to provide clear advice about the rapidly developing science, to help government ministers make the best decisions.
The situation will get worse before it gets better. We will be guided by the science. Be in no doubt, we will do everything that is effective to tackle this virus and keep people safe.
I chair the committee that generates evidence to address particular policy questions. That then goes to another committee which generates that advice, which then goes to ministers. But of course the ministers are taking advice from a large number of people, not just the scientists. Quite rightly, it's the ministers that take that decision.
The mantra of following the science was never a thing. No government does that, nor should they, because there's many other factors to take into account. Their decisions are taken on the basis of a complexity of many different factors, and scientists understand that.
We've new information on the nature of the coronavirus. Latest figures from China tell us the death toll is over 1,800. The highest fatality rate is for those aged 80 and over.
The government is relying on 𝘊𝗵 for advice about how many people might be affected here. The modelers warn that older people are particularly at risk.
The need to have some kind of age-related protection measures in place, I think, was understood by the modelers. The complication then comes in terms of how do you actually operationalise it? How do you do it? Because you're the most vulnerable people, and those people who are most likely to die from COVID infections are the people who are in most contact with other healthcare providers and other social care providers.
It's a risk that staff at the UK's biggest charity care home provider are acutely aware of.
We could tell right from the start that there was a distinct vulnerability around care homes because we had seen it in other countries and we had seen the way that it had started to impact in the UK. We knew hospital discharges into homes was a real potential in terms of the risk. We also knew that clearly relatives coming in could be a risk, and we knew that staff moving about between homes could also be a risk. So we were very aware of it and trying to limit the number of different agency staff, but it was certainly a risk that was writ large right from the very beginning.
The modelers warn that the virus could kill tens of thousands of older people and that cocooning will reduce deaths. Their results go to SAGE. But their model does not reflect how care homes actually work or identify the serious risk posed by agency staff.
The failure of those models, I guess, was that we didn't know how connected the social care settings were with the community. As modelers, we didn't know. I'm sure there are lots of academic and policy makers out there that could have told us this if we'd asked them.
My father was a very caring, gentle, funny, loving man. Great father to grow up with. Loved music, absolutely loved music. And he would conduct away to music with his eyes closed, just to think he was the conductor. Really loved life.
I grew up living with him for most of my life. So him and my grandma, my nana, were kind of like second parents almost. Mm-hmm. So I'd spent a lot of time with him.
And I put him in a care home to be cared for and to be looked after and to be safe. And he was very happy there. If I phoned him up and said, "Dad, do you need anything?" He says, "Sweetheart, I've got everything I need."
Nice.
We thought he was safe. We assumed he would be safe where he was.
Within 4 months, coronavirus will have killed 20,000 people in Britain's care homes. But at this stage, Boris Johnson appears not to understand the risk to older people.
It's not.
It's known as the Red Zone. Almost a dozen towns and 50,000 people now under police lockdown in northern Italy. With more than 200 confirmed cases and 7 deaths, it's the centre of Europe's biggest coronavirus outbreak.
In the UK, there are still few restrictions on public life. Behind the scenes, the government is asking the scientists how many people the virus could kill.
Lots of different parts of government need to plan for different things when there's a major event happening. So for something like a pandemic, then they need kind of agreed estimates of what's the worst thing that could happen, not implausibly bad, but a reasonable worst case for what might happen. The example that we were given is for people that need to buy body bags. You know, they have to have a reasonable worst case.
So the first outputs were in terms of the number of cases. And those were already very high in the millions, but what we didn't really know at the time was how that would translate into deaths. So Neil Ferguson's group at Imperial had produced estimates before we had. I think we were all hoping that they might have made a mistake somewhere, but our own results were consistent with theirs. It was between 100,000 and 500,000 deaths overall.
There was a general realization amongst certainly myself, but some colleagues, of thinking that this was going to be a very significant event.
The magnitude of the projected figures for human suffering we were looking at were just really difficult to hold in your head and to comprehend.
Have you got a grip on this?
Now, Boris Johnson chairs the Emergency 𝘃𝗶𝗰𝗲 Committee for the first time since the virus arrived in the UK.
Morning, Professor Whitty. Do you have a grip on this? Good morning. Are you going to ban shaking hands, Professor Whitty?
He is criticised by some for missing the previous 5 meetings.
Wash your hands for the national anthem. Stop shaking hands.
We were increasingly looking at these non-pharmaceutical interventions, the impact of different changes. What would happen if you stopped work? Yeah, what would happen if you closed schools? Yeah, what would happen if people didn't meet each other in leisure situations?
The government is hoping that a combination of these interventions, introduced at the right time, will be enough to save lives and ensure the NHS is not overwhelmed.
Our plan means we're committed to doing everything possible, based on the advice of our world-leading scientific experts, to prepare for all eventualities. And let's not forget, we already have a fantastic NHS, fantastic testing systems, and fantastic surveillance of the spread of the disease. Our country remains extremely well prepared, as it has been since the outbreak began in Wuhan several months ago. I want to stress that for the vast majority of the people of this country, we should be going about our business as usual.
I was assuming that the great pandemic plan and the great public health system that we kept hearing about was galvanizing itself to produce a response to this pandemic. The government should have decided at that stage to take much more robust action, but they didn't.
I'm shaking hands continuously. I was at a hospital the other night where I think there were actually a few coronavirus patients, and I shook hands with everybody.
Tonight, NHS England categorised coronavirus as the highest level of emergency for the health service.
NHS England said if case numbers go up, all hospitals rather than specialist centres should expect to handle patients with the virus.
Early in the morning, going to work, look at this one. Hi Bubs, look.
She enjoyed her career and she loved being a nurse. I think that was what she was born to do. She was this selfless young girl who couldn't hurt a fly. You know, she was that lovely and very, very open and receptive.
𝗵𝗵𝗋𝗄𝗃 is working as a nurse in Luton Hospital.
The baby was due in early part of May. That was on the 7th of May. So we were just hoping that she goes through her last period of shifts, remaining until she starts her leave and prepare for delivery. I was worried about her. She was worried herself because the virus was everywhere.
On the 3rd of March, the official figures say that 164 people in the UK have been diagnosed with the virus since the outbreak began. But according to a recent study by Imperial College, the real number of infections is over 14,000. For the last few weeks, the virus has been spreading across Europe, and travellers have brought it into the UK undetected.
What we hadn't realised was that the virus had already moved into Italy and France and Spain and was in the ski resorts. It turns out that we had probably 1,500 cases came in that period. And that's why Britain was hit so hard. We were given a really bad dose at a very early stage in a large number.
If I could have known one thing, it would have been the number of imports coming in from mainland Europe. I think I should have thought, if northern Italy has got an epidemic, then it's quite likely that other places in Europe have probably got an epidemic as well. And I didn't think that.
At this critical point, the UK's meagre testing capacity is struggling to cope. Testing in the community will be stopped in mid-March, so tests can be focused on hospitals, care homes and prisons. The government is about to lose the ability to track how many people in the community are infected.
Within the past couple of hours, the Italian Prime Minister has announced restrictions on movement across the entire country, in the most drastic response yet to the spread of coronavirus.
Italy was the real scare for European states, how quickly the ITU was overwhelmed. And I think that would have been sufficient to tell you that we didn't have long to go.
I was not ready to see what I've seen. These are the aisles in our emergency department. All the other rooms were already filled up by patients. So this was the situation where you are deeply in the crisis here, and you have to cope with that. It's a sort of nightmare.
What's happening in other countries doesn't necessarily mirror what's happening here in the UK, and that's why we're following the scientific advice in the way that we are.
Although Italy is in crisis, 𝗫𝗋 tells the government that the peak of the pandemic is still 3 months away.
On the 10th of March, 𝗫𝗋 estimated a 12 to 14 week delay time to peak. We were planning for a pandemic that was fairly slowly growing, on the basis that we had kind of a ramping up of social distancing over a period of time.
But one 𝗫𝗋 member believes the government strategy is seriously flawed. He fears that intensive care units will be overwhelmed for a long period of time. On the 10th of March, Professor Stephen Riley submits a paper to 𝗫𝗋 calling for an immediate lockdown.
Based only on my knowledge of the epidemiological situation, I did think at that point there was an argument for stringent social distancing, for lockdown as soon as possible. The point that I thought needed to be addressed as a matter of urgency was that initially we should lock down in order to have time to formulate a more precise strategy.
There is no consensus on such immediate action, but some on 𝗫𝗋 now begin to model lockdown. However, other scientists are worrying about how long the British public will observe any new rules, something known as behavioural fatigue.
And there is a risk if we go too early, people will understandably get fatigued and it'll be difficult to sustain this over time. So getting the timing right is absolutely critical to making this work.
We're going to ask people to change their behaviour quite radically, which is going to be very difficult for them to do. It's going to have major economic and social impact on them. Then we're going to have to limit the amount that we're going to ask them to do, yeah?
In a week, the NHS is starting to be collapsed. In 2 weeks, it's going to be completely collapsed if we don't take measures now. And people are going to panic, maybe not today if we don't take the measures, but they're going to definitely panic next week or in 2 weeks. We have 13 days of advance compared to Italy, right? They thought the exact same thing 2 weeks ago. And then 1 week later, they realized, oh my God, this is exploding. They have now, what, 17,000 cases? It's exploding then. They realized too late that they were not containing this.
I was one of the individuals back in March, and I would quite happily hold my hands up and say this, that I was concerned that any kind of measure that was put in place, leading all the way up to full-scale lockdown, would only be sustainable for 4 to 5 weeks.
The concern about behavioural fatigue puzzles members of 𝗫𝗋, who advise the government on behavioural science.
Behavioural fatigue is not a scientific term. It was never discussed on 𝗫𝗋, and we were very concerned when we heard it referred to. Very strange for SAGE and people representing SAGE to be using a term that they'd never consulted their behavioural advisory group on.
Mass gatherings are still going ahead. The official figures say that 913 people have now been diagnosed with the virus. But the recent Imperial College study says the real number of infections is over 75,000.
the advice today coming out following the 𝘃𝗶𝗰𝗲 meeting is no different to what we've received before, and they fully expect us to complete the festival.
I think what brought it home to me was seeing quite how close people were to each other, sharing glasses, arms around each other, queues in small places for the toilets, and just thinking, I know how this virus transmits itself. This seems like a super spreader event to me.
It was absolutely clear by that stage that mass gatherings should no longer be allowed, and we were kind of still in this British exceptionalist viewpoint that, no, it's different here, we've got the NHS, we can handle this.
In Liverpool, thousands of Spanish football fans arrived to watch Atletico Madrid play in the Champions League. Madrid is the centre of Spain's rapidly growing outbreak. Almost 50,000 home fans have tickets for the game. 𝘃𝗶𝗰𝗲 is one of them.
Liverpool was his life. He'd been going for 63 years and he loved European games. They were the best nights ever.
They were the highlights.
They were the highlights. He loved them.
We were concerned leading up to the game because we'd heard that there was 3,000 Spanish fans that were going to be let into the city. And Madrid was probably the worst affected city within Spain at the time. So the alarm bells started to ring.
They were on all the transport, public transport. They were in restaurants, they were in bars, they were in shops, they were out sightseeing. They're everywhere. They're everywhere.
My dad's done the same journey to Anfield for many, many years. So from this house, he'd go through Stanley Park, around the Anfield Road area, where he did walk past the Atletico fans. I think the game was 8 o'clock that evening.
We was a bit worried, and then you say, well, nothing's locked down. No one's being told not to do nothing. According to the government, it was okay.
Chamberlain on the move, delivers the cross.
When I saw pictures of that match, it was the same response. As far as I could see, this was just sprays of viruses going every which way.
We are considering the question of banning major public events such as sporting fixtures. And the scientific advice, as we've said over the last couple of weeks, is that this banning such events will have little effect on the spread.
Joining me now in the studio, two experts with different...
Professor Mickey goes on TV, but defends the government line.
So if we close down all sporting events and we have it played behind closed doors, what can then happen? Instead of people being, thousands of people in the outdoors, go to pubs.
No, we just don't have them.
Or what are going to people go instead? They're going to go to pubs and all sit 300 in the warmth. I was thinking that we need to keep trust in the leadership in the government because that's what's needed in order to, manage this pandemic. Had I known what I now know, I'd have been, I think, much clearer and said we should be shutting down all gatherings now.
Despite the government's refusal to act, the decision is taken out of their hands.
World sport has come to a standstill. This morning, after an emergency meeting, the Premier League finally confirmed an unprecedented shutdown until at least early April.
2 weeks after the match, 𝘃𝗶𝗰𝗲 fell ill. He tested positive for coronavirus. 2 weeks later, he died.
To think you can go from a fit man to just getting wiped off the face of the earth within 2 weeks.
It was heartbreaking. Heartbreaking.
They knew it was coming. They knew that it was coming. And they knew it was all over Europe, but they didn't act fast enough.
In Luton, 𝗵𝗶𝗯𝗲 is still working in the local hospital.
She would always come home and undress at the door and go straight to have a shower right from work. In the middle part of March, that was when she felt she was very unwell. Initially, we thought it was just the complications. It was just the complications with the pregnancy, but yeah, things got worse.
The government is reporting around 450 new cases a day. The NHS is still coping, but the modelers know something isn't right.
We were getting some signals from the data which just didn't quite make sense. And in that situation, you know, if you're kind of flying something and the dials start doing strange things, the thing it does is increase uncertainty. You suddenly say, oh, hang on a minute, do we really know what's going on?
Knowing the true number of cases is essential for a realistic assessment of the threat to the NHS. Professor Mark Jitt is asked to investigate.
I think everyone knew that they were not picking up all the cases. The big question was, how much were they underestimating the number? What we decided to do was to actually look at the number of cases in critical care, in intensive care units. We knew for each of these cases, there were probably many hundreds of many thousands of people who have COVID but didn't have it that seriously. We knew that because we had the experience in China, we had the experience in northern Italy, in the US, and so we could take the data that were from those outbreaks and say, if that same proportions applied for every, one person we see in an intensive care unit, there are so many hundred or so many thousand cases who are just infected, but maybe with milder disease. And by the middle of March, we were predicting that there were probably close to 100,000 cases each day. That was extremely worrying because 100,000 new cases would mean that about a week later we would get 20,000 new hospital patients a day.
The NHS is just weeks away from being completely overwhelmed.
There was the sense that, okay, we really need to get this information to SAGE to make decisions about what we're going to do in the UK.
At the same time, other modelers realise that the NHS data they are relying on is out of date.
The data coming in from the UK, which we thought was up to the minute, was in fact, in some cases, up to a week old. And so that really we weren't looking at a snapshot of how the epidemic was developing now, but how it was in the past. That was the first time when I started to feel like things really were not in control.
I think anyone who thinks they get immediate, up-to-date data from the NHS is living in fantasy land. The NHS doesn't work like that. I've worked with and in the NHS for 20 or 30 years, and the data always lags behind, always, 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 particularly when you're trying to bring it together at a national level in a hurry.
Now, alarming new modelling from 𝗵𝗂𝗋 member Professor Neil Ferguson is made public for the first time. It says the government's approach could result in 250,000 deaths and recommends radical measures.
Our best estimates are these measures will be successful at suppressing transmission. If they're lifted, and when they're lifted, transmission is likely to bounce back. Now, there may be in time other approaches we can take to keep case numbers low, but we are going to be living with this virus really this year, probably next year, until we have a vaccine.
The research prompts a dramatic announcement about stringent new measures.
Now is the time for everyone to stop non-essential contact with others and to stop all unnecessary travel. We need people to start working from home where they possibly can, and you should avoid pubs, clubs, theatres and other such social venues.
A growing number of modellers on 𝘃𝗏 are now pressing for lockdown, but Boris Johnson stops short of introducing it.
I obviously was, kind of watching as everybody else was. It was difficult in some ways because I did feel that there was a pretty good justification for lockdown.
That day, Sage has told the government that the number of people with the virus may be doubling every 5 to 6 days.
Without drastic action, cases could double every 5 or 6 days.
But that figure is wrong. The following day, a modeller in Manchester is called by an Italian colleague.
We were going through the data that she had collected, and at that point I got really concerned because I realized that the doubling time was closer to 3 days than to the 5-6 days we were talking about. It was also the hospitalizations that were growing at a similar speed. I was coming out with really short times between that day and potentially breaching hospital capacity with the numbers that were suggested by 𝘃𝗏 at the time. I remember I called Ian Hall.
And there was this sort of pregnant pause on the Skype call as we sort of took in the information. And this is really important and really quite a massive game changer. What it would really mean is that within 1 week or 2 weeks, we would be at saturation of the NHS.
Ian was extremely supportive and well, obviously encouraged me to write these things up. I worked on that report for the entire night.
Lorenzo emailed the information to Graham Medley as chair of 𝘃𝗏 for him to table at the next 𝘃𝗏 meeting for discussion.
So it was a significant meeting because it made us realise that the epidemic was progressing faster than we had thought.
And that was taken to Sage, and that led to the cascade to full lockdown.
From this evening, I must give the British people a very simple instruction. You must stay at home.
The sort of sense of, well, we're in a whole new world now.
I thought, good, finally he said it. But also along with that, what does this mean in terms of the way me and everybody else I know leads their lives?
On the day of lockdown, there are 186 deaths related to coronavirus. Within 2 weeks, the daily death toll reaches 1,000.
Our own modelling suggests that had lockdown been imposed a week earlier, we may have avoided about half or slightly more than half the number of deaths.
In Luton, Mary Boateng is rushed to the hospital where she works with breathing difficulties. She is 35 weeks pregnant.
The initial plan was that I would be at the C-section, but that didn't happen. After I got there, I was told that because my wife is COVID positive, I have to also self-isolate myself, which got her into tears, because I wasn't even allowed to enter the premises, and I had to speak to her on the phone and I reassured her that I was just going to sit in the car and just wait for her. I was just praying, yeah. That was all I could do. So about 1 a.m., half 1 a.m., she called that she was out, and she sent me a couple of pictures on my phone that we had a baby girl. I got a first call from one of the consultants and said, I have a bad news for you. Unfortunately, we've lost your your wife's kidneys. And at this point, the only thing I'll predict is death. Then we went in and they took me to the bedside of my wife, and she was lying there. And I spoke to her. I was talking to her, holding her hands, holding her hair, trying to speak, and yeah, but she was gone. The only thing I could possess and could, hold now was little Mary, and that's why I gave her the mommy's name, Mary.
To see such a toll of tens of thousands of people dying from an eminently preventable disease, for me was absolutely horrifying and devastating. And it could so easily have been avoided, so easily.
Lockdown slows transmission of coronavirus in the community, but deaths continue to rise. The government has failed to do enough to stop the virus spreading through Britain's care homes. At Britain's largest charity care home provider, staff are gathering data about the spread of the virus through their homes.
Our homes were locked down. We were not admitting new residents, and yet the pattern of the viral spread was continuing. And so we knew that the only way that could realistically be coming into our homes was through our staff. And so we were lobbying at that point around trying to get testing so that we could better understand who was infected and who wasn't, and so that we could maximise our infection control efforts in each of our homes. We heard back from Public Health England that there was no evidence that routine testing was a worthwhile approach.
In Essex, Danielle is told her dad Walter has caught the virus in his care home.
We were absolutely devastated. Never dreamt in a million years that this would happen so quickly as well. I suspect that it was brought in by an unsuspecting carer or an agency staff worker, because none of us relatives or friends or family were allowed in.
I think Dad came in and told me that he'd died, so that Mum and Dad got the phone call about 3 a.m.
It's the call that you never ever want to get.
It's only now, in mid-April, that the modellers realise the risk posed by care home workers, particularly agency staff.
We realised that care homes were not isolated and shielded in the way that we thought they were as modellers, but that there was some sort of external connection that was forcing the disease.
So what made you think they were shielded?
We were... that's a good question. We never checked.
Clearly, whatever the policies were in place didn't work, that operationally, either mistakes were made or things didn't happen in the right way. And as a consequence, well, the consequence.
Matt Hancock said that he put a protective ring around the care homes, and that made me so angry, because that was proved to be a blatant lie.
There needs to be a comprehensive public inquiry into the analysis that was undertaken on the evidence that was provided to the scientific advisors and the government. Because the reality is that what we've ended up with is that out of a population of around 400,000 older people in care homes, 20,000 have died.
I obviously feel that it's incredibly tragic what has happened in the UK. And of course, I wish that interventions had been brought in earlier.
There's going to be a lot of criticism of the scientists because it's easy to have hindsight. It's easier to say, if only we'd done this a week earlier, we'd have saved 5,000, 10,000, 15,000, 20,000 lives. Pick your figure. But if you look at where we were in February, would you really have made these decisions any differently? And I don't think you would have.
I don't believe any government follows the science, nor should they. And it seemed to quite a few of us that this may be more to do with PR and to potentially scapegoating scientists when things aren't going well than it was to trying to explain a relationship between science advice and political decisions.
I think we got ourselves into a mess by relying on modelling and allowing modelling to drive the whole response. And I think the failure of the science, so to speak, will be seen as one of the most important features in what has been a very, very poor response to this global health tragedy.